Healthcare is a very dynamic and changing part of our society these days, and hospitals can either be ahead of the curve on that or behind the curve.
I think Cheshire has been recognized and has been successful for the different kind of vision that we have for our community.
You don't have a good community and a coherent, vibrant, healthy community if you don't have a very good hospital anchoring that.
The mission of Cheshire Medical Center, Dartmouth-Hitchcock, Keene is to take care of the community, not just to provide health care.
As an organization, we initiated Healthy Monadnock 2020 around 2006. This was our initiative to try to keep the community healthy.
And really what we're trying to do is to get people to understand that when they provide a healthcare service, they actually have a mission. And usually that mission is about taking care of their community and not just providing healthcare.
We know that we can prevent a lot of illness. A lot of our chronic illnesses revolve around obesity, lack of exercise, and so on. If we can impact people's lives by making them more active, by improving their nutrition, we think we can make inroads into a substantial reduction of chronic disease.
I think what Cheshire Medical Center has figured out, in as much as anybody's figured out healthcare these days, is that it's a complex system at the root of which is an individual person.
It really is an attempt to change the culture around healthcare and to make people understand the significant role that they play in their own health and well-being.
All of us who live here are thrilled that Cheshire Medical Center is as good a hospital as it is. And it is part of a bigger ecosystem for us as a community.
This award is very meaningful to us because it underscores the fact that other people besides us think we're on the right track. Other people think that we have an idea and perhaps a method that will make a difference in American healthcare, certainly in New Hampshire.
The things we're doing are very satisfying. They're satisfying when you can do it on an individual basis. So as a physician, that's very satisfying one-on-one. As a corporation, it's really nice to be able to affect within that corporation a little broader span. But as Cheshire Medical Center, Dartmouth-Hitchcock, Keene, we really can affect the entire community. That's very satisfying. That's the piece that when you go home at the end of the day, makes you feel like you made a difference.